Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurophysician from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very important score, the Aspect score, Alberta Stroke Program Early CT score. The Aspect score, that is the Alberta Stroke Program Early CT score. We are continuing with the neuroimaging concepts, Ischemic stroke part 25 and Aspect score part 5. So Aspects, Alberta Stroke Program Early CT score. Aspects. This scale was designed to determine the extent of early ischemic change in the territory of MCA on a cranial CT. So the range is 0 to 10 in 1 point and is detected from 10 for each cortical or subcortical structure that demonstrates subtle or overt alterations that suggest infarction. So we take 10 structures, and when each structure gets affected, we detect 1 point from the score of 10. So it is found its main utility in identifying patients who have 2/3 or more of the MCA territory infarcted as an exclusionary criteria for certain clinical trials and practices. So the lower the score, thrombolytic therapy or other interventional therapy is less likely to take place, because the lower the score, the more the infarction is. So if the score is high, we can go with these interventional procedures like thrombolysis or mechanical thrombectomy. So if you see this diagram, you'll be able to understand better. So this is the Aspect score, Alberta Stroke Program Early CT score. The range is 0 to 10. So the lower score signifying more ischemic territories. So the lower the score, the more the ischemia, so the less the chance for thrombolysis or other interventions like mechanical thrombectomy. So we take 10 structures. We have 10 structures. We allot 1 point to each structure and we calculate a total score of 10. So as these structures get involved, we start detecting from 10 points. So more and more structures get affected, more and more structures get infarcted, the number becomes lesser and lesser, and therefore the chances for thrombolytic therapy also becomes lesser. So the higher the score, the less the ischemic infarct, the more the chance for thrombolysis. On the contrary, or at the other end of the spectrum, the less the score, the more the infarction and less likely for thrombolytic interventions. So here we need to know, this is basically about the MCA territory, so we have to know the different parts of the MCA. So you have the different coloring. So we have anatomy of the middle cerebral artery, basically 4 segments. So M1 is the horizontal segment. So if here you take this is the M1, this is the horizontal segment. M2 is the insular segment, and M3 is the opercular segment, and finally we have the M4, the cortical segment. This is the cortical segment. So we have the horizontal segment M1, we have the M2 insular segment, we have M3 opercular segment, we have M4 the cortical segments. So what are all the 10 structures we are looking for where there is infarction? The first is caudate nucleus. The next we are looking at is internal capsule. The other structure we are looking is lentiform nucleus, then insular ribbon, then the anterior middle cerebral cortical territory, the middle cerebral cortex lateral to insula, the posterior middle cerebral cortex, the anterior cortex immediately rostral to M1, the lateral cortex immediately rostral to M3, and the posterior cortex immediately rostral to M3. So here if you count, there are 10 structures: 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. So Alberta Stroke Program Early CT score, Aspect score, the range is 0 to 10. So once they get affected, we did it 1 point for each structure from 10. So the lower score signifies more ischemic territories, 1 point subtracted from 10 for each territory involved. So these are all the very important concepts for aspect score, which is very useful for thrombolytic therapy. The other important concepts I put in a book called Exam-Oriented Clinical Neurology, especially the clinical neurology concepts. This book will be very useful for students appearing for clinical neurology exams. If you're interested, this book could be purchased online. The other important concepts of neurology, especially the theoretical aspects, I put in a book called Focused Neurology, written by me, Dr. Sreenivas. It is put in a question and answer format. This book is available online from all leading booksellers, including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts of aspect score. If you have enjoyed it, please share the link. Please like it, but please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.